So today our topic is on style. What have you heard about style? Have you ever had style on your eyelid? What is style? In this video, we'll be talking about what style is all about, the definition, the causes, symptoms, treatment, and management, implication, then eye care tips, stroke prevention. By the way, my name is Dr. Fias. You already know I am always bringing you relevant and accurate eye care tips, helping you know more about eye health and you see your very best today, tomorrow, and in the nearest future. If you're watching me for the very first time and you would like to learn more about your eye health, kindly click on the subscribe button and as well turn on your notification button so you don't miss out on any of our educational videos. So when we talk about style, it is not actually the style of your clothes or fashion, but an infection on your eyelid. Medically, it is called hoodlum. So style is simply an infection of one of the glands of your eyelid. It is basically of two types, internal and external hoodlum. So when you see star, you can differentiate it by the pain, the redness, and the swelling of your eyelid. It is quite different from chalazon, but we'll get to that as we proceed. So in this video, we are also going to differentiate between star and chalazon. So this is Dr. Eye Care Tips. On this channel, you will learn a lot about the eye, vision, and eye care tips for the best of vision. So, if you're already a subscriber, I appreciate you. And if you are watching me for the very first time, please kindly click on the subscribers button. Stay tuned. Don't go nowhere. I got a lot for you. Well, like I told us earlier, external hoodlum is one of the type of style or hoodlum. Remember, we have internal and external, but external is more common and it looks more like pimple, but it is not actually pimple. And this is another thing we have to differentiate from style or chalazon. It is not pimple, so be very careful when you see it. It is usually swollen with a white head, and if you are not careful enough, you might be tempted to pop it. Do not pop style or chalazon. When you pop it, you might push back some of the contents of the style into your system, which will lead to the occurrence or probably the spread of the infection. Remember, we said it is an infection of one of the glands of your eyelid. So do not pop, do not pop, do not pop. When we talk about style, we have two types, the internal and external, but external is more common. Although in some cases you also see patients have internal type of style or hoodlum. Then when we compare it with chalazon, they look the same, but not the same. When you're talking about style, it is always painful, it is red and swollen. But in chalazon, it is painless. It might not really be red, but there is a pump or a swollen part of it. So the major difference between style and chalazon is that style is painful, while chalazon is painless. They might look very the same, but not always the same. Pimple is always very simple, but do not mistake style for pimple. And remember, we said do not pop style so that you don't spread the infection or push back some of the content of the style that are meant to leave your body or the part of your eyelid where the infection occurred. So be careful with this tray. Talking about the causes of style, I already made mention of the fact that it is an infection, a bacterial infection of one of the glands of our eyelid. The symptoms include mostly pain, redness, and swelling of the eyelid. So when we talk about treatment, the first treatment is by the use of antibiotics since it is an infection. But even at that, you have to see your eye doctor. Go to the nearest eye clinic in your location for proper assessment, diagnosis, and treatment. Emphasis on proper assessment because you might not really know if it's Stye, chalazon, but probably you can know if it is painful. But these two, you can't really differentiate unless you see your eye doctor, or probably you already know the difference between Stye and chalazon. So visit your eye doctor, know which is the problem and the best treatment option. But let's assume it is Stye. The first treatment is by the use of antibiotic. Most people prefer oral antibiotic. Why? Some other people might not really go for it. Topical antibiotic might also come in depending on the situation or the severity of the case. Talking about treatment of Stye, which I made mention of the use of antibiotic after you must have consulted your eye doctor. There is also another way, a more natural way, which is probably the best natural way to treat Stye, which is what we call warm compress. This is the best way. If you know how to do it, you will get the best result. When we talk about warm compress, you have to bear in mind three things: heat, time, and frequency. You have to consider these three things, put them into consideration if you actually want the best result from warm compress. So let's go there. We'll take them one after the other: heat, time, and frequency. When we are talking about warm compress, which is the best natural way to tackle Stye, we have to consider three factors: heat, time, and frequency. When we talk about heat, when you are doing your warm compress, ensure you have a constant heat on your eyelid, at least very moderate heat, not hot. That is why we call it warm compress, not hot, but a moderate constant heat throughout your eyelid. This will help to melt the oil that has solidified, which comes from your oil gland. Remember, we say style is an infection, so the heat will also kill the germ, the bacteria that are causing the infection on your eyelid. On the other hand, it will also allow for free flow so that your immune system can be able to fight the infection properly. So when we talk about time here, make sure you have a constant heat for at least 10 minutes each time you apply the warm compress method. You can go more than 10 minutes, you can go 15 minutes, 20 minutes or more, but make sure each time, each part of the procedure, you have a constant heat of at least 10 minutes. So going to frequency, ensure ensure you are frequent with this procedure to get the best result. Make sure you apply this procedure at least 4 times a day until you have your desired result. So whenever you think about warm compress, which is the best natural way to tackle Stye, consider these three factors and put them into consideration. So at the end of the day, you will have the desired result. Well, talking about warm compress, you need to consider these three factors. And even at that, you also need to know that using a washcloth to do warm compress might not really give you the desired result because you are going to break the rule of constant heat here. When you use a washcloth to do your warm compress, when you dip the washcloth inside the warm water, by the time you remove it and place it on your eyelid, most of the heat must have escaped. And at that, the constant heat that you need to get the desired result is already missing. So you are already breaking the rule of warm compress. What do you do? If you cannot use a washcloth to achieve the desired result in this process, what are you then supposed to use? And the answer is an eye mask. Use an eye mask. You can always heat it up, probably with a microwave for some minutes. Then wear it on your eyes for 10 minutes, 15 minutes, 20 minutes. Then you can remove it, heat it up again, wear it back. This is more preferable and probably should give the desired result which we desire from this process. So if you have been using a wash cloth, you can upgrade to an eye mask so you can get the desired result. Well, it is also very important to point out for us that whenever you have stye or any inflammation that has to do with your eyelid, probably blepharitis, you also need to understand that personal hygiene, especially cleaning your eyelid, is very important, especially with antimicrobial solution. This is why you need to talk to your eye doctor so that you know the best antimicrobial solution to use. You can always use it to clean your eyelid. Even when you are not having any serious infection, once in a while, you can use the best microbial solution to clean your eyelids. This will reduce microbe or antibacterial activities, infection, and all that on your eyelid, and keep your eyelid clean and free from infection. So always talk to your eye doctor so that you know the best antimicrobial solution to use. So before we come to the eye health question of the day, it is also very important to let you know that ignoring stye or any form of infection around your eyelid can lead to something serious. So as soon as you notice anything that you don't understand on your eyelid, go to the nearest eye clinic in your location, consult your eye doctor for proper assessment, diagnosis, and treatment. Also, talk to your eye doctor on the best microbial solution to use and how to use it. Probably you should use your microbial solution with a cotton wool. Clean your eyelids properly, gently. Take note, gently. Clean it properly and gently. So, have you had stye before? Do you know anyone that has experienced stye? Have you been confused between style and chalazon? What was your experience? Let us know in the comment section. Like, comment, and share with your family and friends. If you're already a subscriber, you can always let us know your observation. If you're watching us for the very first time, click on the subscribers button and as well turn on your notification button so you don't miss out on any of our educational videos. Stay tuned, we have a lot coming your way.